You never forget a beautiful smile, and our next guest is no stranger to creating fabulous smiles.
Dr. Howard Steinberg of Tucson Smile joins us to tell us how he can help us get that beautiful smile, starting with our teeth, right?
Yes.
It's always something that somebody notices right on your face, like your eyes sparkle and your teeth.
Absolutely.
So you've always come right before one of your seminars, so I'm guessing you have another one to share with us?
Yes, we have a seminar, and it's next Wednesday, the 17th, and at 6:45 p.m. at the Hampton Inn, and we'll have a little thing here to show that. But certainly we want to make sure anyone that has any questions about dental implants can come and find out more about them, because there's a lot of misconceptions that are going on out there. And one of them is it's painful. I had someone tell me that today, actually, this morning. I just ran from my office, and it's not true. You know, the average patient might take Advil and Tylenol that night and maybe or may not the next day. So it's really a very minimally invasive procedure today.
And that's why I think having these seminars are so important, because dental implants have drastically changed over the years.
Oh, absolutely.
And I think people oftentimes have that misconception that it's still the very old school way of doing dental implants. And it's just not like that anymore with technology.
And over the year, it changes over the months. You know, in fact, there's something at a show that is a new procedure that I just started doing the last few months, that because it just keeps changing. Technology is driving us to better, newer and better things, and just computerization of teeth allows us to even make teeth and make you another set, exactly duplicating it, which we could never do before. So it's very exciting.
So you're keeping up with all of that new technology. It's never too far ahead of you. Your office is up to date on all that stuff, so you are able to offer it to all your patients.
You know, I have a study club actually for dentists that I run for the last 15 years. So I have one next Thursday. And Wednesday, and Thursday night I have my dental club, which is about 70 dentists in Tucson in it. And so I'm always looking for new information to give them. And I have speakers that come around from the country, but I speak 2 or 3 times a year, and I review literature, and it's hard for me to keep up. And they look for me to tell them what's going on, and that's exciting. I love dentistry. I love to be able, you know, it's changed so much since I've been practicing. You know, actually it'll be 35 years next year, so
wow.
I've been around doing that a while, and, and I'm starting to learn it.
And I think being a dentist is more of also being an artist.
Absolutely.
As well. I mean, you are changing smiles, and it's fitting the structure of a face to a smile and redoing that. And I know you always bring some beautiful pictures with you of some of your work that can be seen all around Tucson. Right here, walk us through what we're looking at.
Well, this is a patient that had totally worn his teeth, and we restored all of his teeth. And this was crowns, and we have many different materials we use. Every patient different. This happens to be crowns and veneers combination, and we can totally change the color, the size, his whole bite. In his case, this is over 10 years ago we did this, and he's doing great. He's a wonderful guy.
And with veneers, you don't even have to worry about teeth whitening.
That's correct.
Those stay beautiful.
And in fact, the teeth, some of these cases you'll see, are very light compared to what your natural teeth might be, because people want that today.
Yes.
And we give people we can make it dark, spot, we can do anything today, but a lot of people like it light. This is a dentist, actually, and this is from 1996. And I just 2 days ago, he sent me an email. He's up in Phoenix, and he's a root canal specialist. And we did his teeth, and he actually hasn't done anything. These are almost 20 years old, 1996. So the next one there's veneers.
Oh, wow.
You know, just changed his, and he has tremendous stress on the teeth. A real grinder, and he hasn't broken anything in almost 20 years. So the materials are getting stronger and stronger. And our ability and they're better today. This is weak compared to what we had.
I was just going to say, I mean, you're talking about possibly even 20 years ago that some of these photos were. I mean, how different is it today?
In fact, 5 years ago, if you said really grind your teeth, I would say you need porcelain fused to metal. We would have metal or gold inside. Today, it's all ceramics. We have zirconiums, all done by computer in one material, and they're tremendously stronger and more wear resistant. They wear with teeth better. We're just getting better and better. This is a patient that had tremendous problems with, and this is an implant case. They had gum disease, major issues, hated the way their teeth look, and this was a dental implant case, and these are immediate. This is a teeth in a day situation where we extract teeth and place these immediately.
You do such beautiful work, doctor. You really do. I mean, these smiles, I mean, I can only imagine the confidence that people have leaving your office.
That's, well, thank you. It gives me tremendous reward to be able to help people like that. And this is another case, and everyone's different. The one part that you mentioned, art, is that there's not one look for people. Everyone has different desires, and we try to meet whatever their need is for that, and that's the exciting part. And that requires trying and seeing it, and my technician and myself are there and doing everything together, and if we're doing porcelain, we'll make a change in our office. I'm a prosthodontist. I specialize in advanced work, and so the people come to me because they have great needs for that. But there's lots of general dentists in the community that can do wonderful work, and I think part of my implant seminar is to let people know what's available. There's lots of dentists in town that can do things for them, not just myself, but certainly I'm here to help them. And one of the things I want to make a point, because I've had people ask me in my seminars, how about maintenance and things?
Right.
You know, dental hygienists, I have 2 hygienists in my office, and they're crucial.
Yes.
And even I have lasers now. I have 3 different lasers in the office, and we use it for cleaning and for sterilization, and we can do more and more things for bone regeneration. So that's become a very big part of our practice, and many dentists. And you need to do that. It's similar to anything else. You're making an investment. You need to maintain it, take care of it, in anything.
And
Absolutely.
education is such an important component to that.
Oh, and I love the seminars, by the way. The patients are, even if they're not in our office, they ask great questions. Afterwards, I always feel great just to do them. So I love doing them. I hope that we get people to come out and visit it, because every time is different questions and different concerns, and I'll address any question that the patients have.
Well, you do beautiful work, like I said. Doctor, thank you so much for joining us today.
Thank you. It's always a pleasure.
Dr. Howard Steinberg has a free seminar coming up on Wednesday, September 17th, starting at 6:45 at the Hampton Inn, located at 5950 North Oracle Road between River Road and Orange Grove. To help you figure out if implants are right for you, to reserve your seat, you can make an appointment by calling his office at 886-3030 or go online to TucsonSmile.com. Again, that's 886-3030 and TucsonSmile.com.
When the Morning Blend continues, a local group of firefighters honor their fallen first responders, and Amanda pitched in to help as well. We'll talk to them when the Morning Blend returns.